breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
Guys, welcome back to this week's episode of Brainstorming with Dr. Glenn Harrison and Dr. Kolby Condos. I'm Dr. Kolby Condos. Dr. Glenn Harrison.
I'm Dr. Harrison.
Nice to be back. We took a little bit of a hiatus for a couple of weeks. I think it was like 2 weeks where I doing some hunting and traveling and stuff like that. So it's good to get back and get rolling on this stuff again. This episode, we are going to cover what's kind of been a hot button topic, which is traumatic brain injuries and concussions. So myself, I'm a board certified chiropractic neurologist through the ACMB. I'm a diplomate. So I'm going to drop a little bit of insight and knowledge today and hopefully give you guys some information that maybe you didn't have previously, and maybe validate how some of you are feeling post-traumatic brain injury. So let's get started, man. So I'm just going to let you Q&A me a little bit because that
sounds great, Dr. Kolby. So what we'll do is I think I'm gonna drill you on this podcast here and what can be done and get the ins and outs of what happens in your practice, because I know you see many cases like this. This is your specialty, not mine. So we're gonna pick your brain today, no pun intended.
Right.
So I see TBIs come in the office, traumatic brain injuries come in the office, and I'll work with them a little bit. A lot of times I'm referring out, but I kind of want maybe your insight. I know some people that are watching this, they're probably watching or listening to this because they have a friend or they're dealing with something, and they've experienced something like a TBI. Once they have a TBI, what now? What someone walks right in, what direction would you go with them?
So first off, if someone has a TBI, usually they know they have a TBI because they got struck in the head. That's usually the most common cause. Not always the only cause, but the largest, we'll say. Those people that walk into your office, they're going to be coming in, they're going to be complaining of difficulty concentrating. They're going to have issues with navigating their world, where they feel like they're dizzy or they feel disconnected, where they feel really foggy. And that can be from a variety of causes. They're going to have issues with sleep patterns, anxiety, fatigue. I mean, all of these symptoms can happen after a traumatic brain injury, and they happen for a variety of mechanisms. We won't get super deep into those because we don't have the time, but just know that if you've had a brain injury, you've had trauma to your head, or and you're suffering from these symptoms that we just talked about, the anxiety, the fatigue, the difficulty concentrating, the brain fog, the vertigo, or the dizzy feeling, all those are really normal, and all those can be treated by someone who knows what they're doing.
Okay, so now these are some of the common symptoms. How soon would you expect or some people aren't even aware of what kind of mechanism could create a TBI? A lot of people believe that you actually have to hit your head really hard.
Sure. So, I mean, hitting your head is the most common, but even a body blow can suffer. You can suffer concussion. So if you watch professional football at all, a lot of the times you'll see when, a wide receiver or a defensive back or whatever gets hit really, really hard to the body, that can cause concussion-like symptoms. And that's from actually increasing intrathecal pressure, can cause a pressure change within the cranial vault and can cause concussion-like symptoms or traumatic brain injury. Another one would be a whiplash injury. And basically when you look at it, it's not necessarily just the physical trauma of the direct blow to the head, but it's also the shearing motion that goes around as your brain is moving around inside of your head, or the torsional aspect of it, because a lot of the symptoms that I see in my practice happen from people who have very mild onsets of injury. So for instance, I have a patient right now that got kneed in the head during an athletic game, during a hockey game, but it wasn't a really significant blow, and he was wearing protective gear. So he's that was weird. But then he started having things like aura. He started getting a little bit sick to his stomach. He started feeling dizzy and lightheaded. So they pulled him out of the game. But those are all things that you need to basically interpret as far as the the mechanism of injury for the brain injury, it doesn't just have to be a direct blow to the head. It can be other mechanisms too. So if you have like a traumatic event and all of a sudden you have all of these onset of symptoms, then you need to go in and get checked out.
Okay, so now we've got understanding the mechanism, common symptoms to be aware of. Now they walk into your office. What is the first thing you're going to do?
So the first thing I do when I have a patient is you want to know when the brain injury was. You don't want to try to treat a brain injury too soon because that can actually have like negative outcomes. So you want to make sure when the injury was, and you want to make sure that you're treating that patient after like an appropriate amount of time following the injury. You also want to make sure what the symptoms are. I always have my patients fill out the paperwork prior to coming into my office because that can be really demanding, and it's really in depth, and it's lots of pages long. So I have them fill that out prior to coming into my office. I've reviewed their paperwork prior to coming in, and then I do a really in-depth neurological exam. My neurological exam is going to include like cranial nerve exam, deep tendon reflexes, muscle strength, coordination, gait, balance. And then you can kind of start to localize where you think that this injury took place within, the nervous system. Do you think it's like a higher cortical lesion? And when I say lesion, I don't necessarily mean like a stroke or tumor or anything like that. I mean areas of the brain that aren't maybe functioning as highly as they should, or aren't as functioning as efficiently as they should. But then you can start to localize the area where you think that they're having issues, and then you can start to apply some targeted neurological rehab to try to make changes within that patient.
So what you're doing is, if we want to talk about a lesion, we could almost say it's one spot in a wire that's a little bit burnt. Information from point A to point B isn't going through there maybe efficiently enough or as fast enough.
Sure.
If we want to dummy it down.
Yeah.
And then with your testing, you're going to do everything you can to identify the area of the brain or the lack of function and where that lack of function is in the area of the brain, and then doing specific targeted rehab, whether that's stimulation or whatever, to reforge the connections.
Right, to try to strengthen and reintegrate those areas of the brain that aren't functioning as highly as they should.
Because of the injury.
Yeah,
so
exactly.
Sometimes we always hear, right after a TBI, bed rest is the best.
Sure.
I know you have some viewpoints on that. What are those?
Yeah, so I mean, there's kind of conflicting literature coming out on this. There is some research that's showing that some aerobic activity after traumatic brain injury can improve outcomes. I don't think that, in my professional opinion, and basically what I preach to my patients immediately after, I don't usually see them immediately after a TBI. But lack of stimulation initially is not necessarily a poor thing. I'm going to give them maybe some dietary modifications that they can make. But I think that the whole rest until the symptoms are gone is not maybe necessarily the most effective or efficient way of managing or treating a brain injury. Not that you can really treat them, but you can really help the patient to reforge those connections or redevelop that, those neural pathways by using some really specific, neural rehab.
Okay, so that's more, what you kind of illustrated was more of a non-medical, non-allopathic way of working or rehabbing an injured brain from a TBI. What is it? Now we imagine the same individual after a game getting concussed, and they walk into a medical clinic. What is the medical clinic strategy?
So in this particular patient's instance, they gave him melatonin so he could sleep, and then they gave him an impact test, which just basically measured like his cognitive abilities, and obviously following a brain injury, they were going to be significantly delayed and slower than they were prior. So they just removed him from play and told him to rest and avoid electronics, is what his initial treatment plan was. They did have, additional steps put in place were he to not like progress the way they wanted. And for some reason, he just decided to come into me because he wanted to seek a second opinion, I guess.
Mm-hmm. Okay. So that was the model. Is there pharmaceutical approaches to these?
Not really currently. If you have migraines and stuff like that, they can prescribe different medications to help kind of deal with the migraines. Imitrex is really common for patients that have concussions that have migraines as a consequence of that. I've seen that really commonly.
So I don't know if you can answer this. An expected outcome, someone has a traumatic brain injury, they have brain fog, concentration difficulties, probably some nausea, lack of brain endurance or cognitive endurance. And they come to you and you're gonna do this evaluation, the examination, and then start rehabbing these structures of the brain that you find that are weak. What expected outcomes have you, because I know every case is different, but what kind of outcomes could someone expect, or I don't even know if I want to use that word expect, but what have you seen?
So maybe a good way of phrasing it would be like, what have some of my patients experienced as far as like their outcomes? Maybe because it's really hard to set expectations because you honestly don't know.
Mm-hmm.
It's on a case-to-case basis. I had one patient that had a very, very significant traumatic brain injury who, as a consequence, they've developed spasticity in one of their extremities. A reasonable expectation that we have kind of set for this particular individual is that we would like to regain at least 30% of the range of motion in the affected limb. I think that that's probably achievable, but then you have to put into perspective the time frame. Like, how long do you expect this to happen? You don't really know in that case because this individual's was really significant. I have had other people who have migraines that are 10 out of 10. I always try to taper expectations, but also try to, I guess, under promise and over deliver.
Mm-hmm.
We got the patient's migraines taken care of. The patient I worked with today actually had migraines, difficulty concentrating. One of his symptoms was that he was having issues with recall on words. He hasn't had that in probably about 3 days. And then the issues with like him feeling disconnected with his body, using some specific maneuvers and stimulus and stuff like that. We've got that managed to a reasonable level where he actually feels comfortable walking into stores and stuff like that. Target, Walmart, where before he wasn't able to do that either without feeling significant distress and actually overwhelmed and getting super, super anxious. So that's also achievable. So on a case-to-case basis, you get to make those, I guess, not really decisions, but you can kind of get a feel for each one. Patient compliance is going to be huge if you give them exercises and stuff like that to do, having the patient do the exercises regularly. But then again, in a very safe manner where you're not giving them too much. So positive outcomes are usually achievable. I think that the most important thing for my patients that I kind of preach when I'm working with them is I'm going to test, perform whatever therapy or rehab I want to do, and then retest, because you never want to get a negative outcome as a consequence of your therapy, because that shows that you're doing something inappropriate.
Okay. And I know there's a lot of talk about concussions. When you see someone with a concussion and you're rehabbing them and they're doing better, they're doing great, and they're back on their game, do they ever need like maintenance care to come in for more rehab intermittently? What do you see with that?
I do have some patients that come in periodically, and most of the time it's not following another brain injury. It's mostly because they're like, I just want to get checked up.
Mm-hmm.
I just want to check in with you, tell you how I'm doing. You can still do stuff like that. I think that the best thing is just to have a baseline on people if you can.
Mm-hmm.
If you think that you're going to do sports and stuff like that where a brain injury is a possibility, maybe go in prior to it so you have something to measure pre and post brain injury. I always try to preach that a little bit to my patients or to athletes that I maybe have seen prior. But yeah, I mean, they do come in periodically for rehab or checkups or whatever.
And I know another thing about the outcomes are from what I've seen, largely dependent on what state their brain is in before their injury, how neuroinflamed they are.
Yeah, I think you could definitely make that argument, right? So I think we've covered this in some of our other episodes and stuff like that. But if you have a patient who's following a really strict, healthy diet, they're eating a healthy balance of fruits, vegetables, protein, fats, and then you take another individual who's eating, refined sugars, carbs, processed foods, soft drinks, all this kind of stuff, they're going to probably not have as positive outcomes following a brain injury as the patient who has a healthier diet.
And what about because you've probably seen it where people have multiple concussions? What is the expected prognosis after they've had 3 versus 1, or I think you've even had 5?
Yeah,
people with 5 concussions.
I have one patient that's had like 7. and that's a lot. But basically, when you look at it, without going too deep into this, there's it's called second impact syndrome, where once you get hit in the head, the blood-brain barrier kind of breaks down a little bit. Your brain becomes more inflamed. The cells in there that kind of help you take care of the inflammation become more primed and ready to rock. So then all of a sudden you get, a smaller, less significant injury, and it doesn't even have to be to the head or neck, or whatever can cause another concussion. So yeah, I mean, it is a definite possibility, especially if you've had one or multiple, you're going to be more likely to get another one.
Okay.
Likely.
Yeah. And when people, because I know there's probably some athletes, some young or seasoned athletes listening to this, what are the consequences of not pursuing proper brain therapy or brain rehab after concussion?
So I heard this from one of my colleagues, and he basically summed it up in a way that made perfect sense to me and a lot of my other patients when I say this. A person who doesn't have side effects or consequences of a traumatic brain injury after a significant one, their brain is not healed. It is just compensating very well. So they're still going to have areas where they, if they go under a high level of metabolic load, so if they're super stressed out, if they're trying to multitask, if they're doing all, then is when you'll see the consequences of the concussion or the traumatic brain injury. These can come on years down the road. Everyone thinks like, oh, I had a concussion like 2 days ago. I'm fine. I'm not feeling it. You can have a consequence of that brain injury 6, 7, 8, 9, 10 years down the road, because maybe you were just able to buffer it, is kind of a way that I like to say it, where you're able to kind of pick up the pieces and compensate really, really well for a long period of time. But then all of a sudden you undergo a change in your life or diet or lifestyle or stress. You have a kid or, have a loved one pass away, whatever it is. Then all of a sudden, boom, you got fatigue, brain fog, anxiety, migraines, double vision, a whole bunch of stuff can happen.
So this new layer of stressors, the examples you're giving, would you say that they're kind of challenging that weak spot on the brain that you've been able to get by, but now it's pushed too far because of the new challenge?
Yeah, or if you have like, say, a spot, this is dumbing down a bit, but if you're having one area that's compensating for an area that's not working as well, but then all of a sudden you're placing more demand on that piece, on that area that's picking up the pieces, so to speak, right? It's picking up the slack, and all of a sudden it can't keep up. That's when the deficits can start to come out, or that's when the symptoms can start to come out too.
Okay. And I've seen some TBIs where they get worse with time. Someone will say, 10 years ago, they've never been quite the same, but it really never, some of the cases I've seen, they say they got better, but not really. What is the outcome if someone waited a year versus 10 years to get?
Right. I think that the longer you wait, the harder it gets, because within reason, I guess, you don't want to treat it too early, because you can't, if you treat it too early, you can cause a lot of damage if you're not careful. But I would say someone who waits 10 years versus 1 year, like that's a lot of time where you can maybe burn out potentially viable, good nervous tissue that you can use to maybe help buffer some of those symptoms and consequences of the brain injury. So if you have one and you're starting to have symptoms now, don't wait to get help. Just go get help. Find someone who's qualified, or contact me, and I'll help you find someone in your area that's qualified, and don't wait, because the longer you wait, the more damage you can do and the harder it can be ultimately. Because here's the thing about, we're always talking about neuroplasticity, or, your brain's ability to grow via, synaptogenesis and all this stuff, which is basically just fancy words for saying that the more you use a pathway, the better it gets, or the stronger it gets, I guess.
Like a real life example of that would be trying to remember your PIN card on your bank card, right?
Exactly. Hard at first, the more you use it, second nature, right?
Yeah.
Tying your shoes, stuff like this, that's all neuroplasticity. But what you also have to think about is neuroplasticity is not just positive. It can be negative too, right? So someone who, has a bad habit and they do it over and over and over again and it becomes reinforced, that's negative plasticity. So it doesn't just go one way. So the longer you wait, following a brain injury and you've developed all these bad habits, neuroplasticity can actually make things harder to treat if you wait longer.
Okay. So for people listening to this and they're after this, hopefully they're going to seek somebody out like you or you if they can get to you. But before that, are there any things, any triggers, any stimulus, anything that are shooting from the hip here? You don't even know these cases that you would say is kind of a red flag until you go in and get some help or pursue you or whatever.
As far as I guess, are you asking me, is there anything if I had a brain injury?
No, anything that you would recommend for the people listening that they could bite into and do before they get to finding a provider like you, whether it's avoiding something or adding something or.
Sure. I think that like having a balanced diet is going to be beneficial for sure. Mm-hmm. High in fats, fruits, vegetables. Maybe controlling your blood sugar is going to be beneficial. Avoiding, I guess, immune irritants that can trigger inflammation, processed foods, sugars, refined sugars, stuff like that. Avoiding backlit electronics has been shown to be beneficial following a brain injury. All those things are good.
Okay, when you say backlit electronic, like
cell phones, iPads, computers, LED, TVs, flat screen TVs, all that kind of stuff.
Okay. Now, what was the last TBI case that you had in your office? And we'll wrap this up.
Yeah. So, I had one today. This is the kid with, 7 concussions. They're a high level athlete, trying to, keep their athletic career alive. I don't want to give too many details out about it, but kid's doing better than I expected. When you see the paperwork and you see I've had 7 concussions on there, 7 documented concussions, and you're like, oh crap, what is this going to look like? But they're doing really, really well. They're making good gains. Some of the stuff that we have set as our goals has improved. It's not gone. I've only been seeing them for about a week now, but we're making.
You're saying they have that many concussions and you've been with them for a week, but there's measurable improvement just in 1 week?
Yeah. So what I do with some of these patients that have brain injuries, I'll actually see them multiple times through the day for shorter appointments. And that's the whole premise of building neuroplasticity, where you want to not fatigue them, but you want to strengthen those pathways through, you can do it through frequency, intensity, or duration. And frequency is probably the safest. It's kind of like going to the gym and building biceps. You can go, every day or 3 days a week, or you can go once a month for 8 hours, or you can go once and try to lift 500 pounds kind of deal.
Yeah. So
the more frequently you stimulate something, the more efficient it gets.
Mm-hmm. So it's you're retraining the brain. That's really what you're doing. And then in small bite-sized pieces that are going to be more manageable than longer sessions, not as frequent. You could over challenge the brain.
Absolutely. Fatigue it. And then you can have negative outcomes or consequences because, when you're fatiguing something, you're actually, burning out nerve tissue or whatever that, you won't ever get back. We're born with a finite number of, neuronal cells. So when you burn them out, they're gone. They don't come back. So the ones that are good, you want to save them.
So if we could generalize here, I'm kind of putting you on the spot, and someone came in, they didn't necessarily have 8 concussions, but they had at least one serious TBI, and they had a little bit of downtime. It wasn't, just yesterday. Maybe it's been a couple weeks. I don't know, maybe 3 weeks. And they come into your office. Would you say, if they were compliant and followed, that there should be some, across the board, there should be some degree of measurable improvement in the course of 3 weeks to a month?
Yeah, I think that's probably a safe assumption. As long as they're compliant and they're doing what they should do. And again, you're testing, you're retesting, you're doing re-exams periodically throughout the process. I haven't had anybody who hasn't at least had some sort of gain. And here's the thing too. If I have patients that don't necessarily improve at the rate that I want them to, I send them to someone who has maybe better diagnostics, that has maybe more objective measurable data, that has like a VNG or, sacodometer. These are just tools that you can use to measure things with like eye movements or balance scores and stuff like that So again, if you're not getting the desired outcomes you want, then you just send them to someone who actually has a little bit more of the quantifiable stuff, and maybe they're able to find something that you were missing.
Okay. Well, that sounds good. Well, I think we're going to wrap it up there. So whoever's listening to this and is in that challenge and has been told to continuously just have more bed rest and stay out of the game, how do they get a hold of you, Dr. Kolby?
Sure. So you can get on our website, which is www.northlakescheropractic.com. You can hit us up on Facebook, which our Facebook page is North Lakes Chiropractic and Functional Neurology. If you're looking for a doctor who has a lot of experience with traumatic brain injuries, there's a website called www.acnb.org, and there's a section called Doctor Locator where you can find a lot of qualified professionals to help that can help you manage your symptoms. And yeah, what about yourself? I know that you maybe don't do the neural rehab, but you can definitely hit up the diet and lifestyle part of this. What about yourself?
Yeah, the neuroinflammatory standpoint, www.drgharrison.com, or you can just search the Center of Functional Medicine and you'll find us. A lot of resources on there, a lot of metabolic efforts on there. We'll work with some neurological injuries, but it's more from a metabolic standpoint. So yeah, we just need some of our clients to run back and forth across the country from Denver
right?
to
It's
Minneapolis.
Just a brief, 16, 18-hour drive.
Yeah. All right. Well, thanks, Dr. Kolby. We look forward to talking to you next day, where we're going to jump into another session of brainstorming.
Absolutely, man. It was a pleasure. Can't wait.
Okay. Take care.